As a technologist in training, I find that we take a lot of chest x-rays. Just about everyone and their mother gets a chest x-ray. Oftentimes, these x-rays are ordered to check for pneumonia. Many of these patients under our care suffer from pneumonia, and it is important to be more aware and conscientious of it. So, what is pneumonia? Infection of the lungs that is caused by bacteria, viruses, fungi, or parasites. It is characterized primarily by inflammation of the alveoli in the lungs or by alveoli that are filled with fluid, affecting the lungs' ability to absorb oxygen. Some symptoms a patient with pneumonia might experience are shortness of breath, chest pain, fatigue, and nausea. Recognizable evidence of pneumonia might include dyspnea, coughing, fever, vomiting, or diarrhea. Fever, chills, coughing, and breathing problems follow infection of the lung. These are usual signs and symptoms that constantly occur together with pneumonia. Some people are more likely than others to develop pneumonia. Individuals at higher risk include those who smoke, abuse alcohol, have other medical conditions such as COPD, emphysema, asthma, HIV, or AIDS, older than 65 or younger than 1 year of age, have a weakened or impaired immune system, have recently recovered from a cold or flu, have recently been hospitalized in an ICU. Pneumonia might lead to pleuritic pain, phlegm, and can further complicate into bacteria forming in the bloodstream, low oxygen levels, pleural effusion, or lung abscess. Treatments vary based on the type of pneumonia. Antibiotics, antiviral meds, antifungal, rests and fluids, OTC anti-fever pain meds, intravenous antibiotic, and oxygen might all be used to treat different types of pneumonia. Pneumonia can be short and rapid, or it can be gradual and long-term. For acute cases, classic bacterial Streptococcus pneumoniae lasts less than a week. Most of bacterial pneumonia will stabilize in 3 to 6 days, where chronic nocardia, astomyces, and blastomyces dermatitis are ongoing and hard to fight off with traditional methods. Elderly with other lung problems, recovery may take more than 12 weeks. So what causes pneumonia? Infection of the lungs alveoli can be caused by many types of infecting organisms, such as viruses, bacteria, bacteria-like organisms, fungi, or parasites. How is pneumonia identified? Physical exam, x-ray, blood tests can confirm pneumonia and determine the severity and location. These tests also help identify whether the infection is bacterial, viral, or fungal based. This can determine the different subcategories of pneumonia. Once diagnosed, what is the predicted outcome and how long will it take? With treatment, most types of bacterial pneumonia will stabilize in 3 to 6 days, but with elderly patients with other lung problems, recovery may take more than 12 weeks.
In the United States, pneumonia causes more deaths every year than all other acute infectious diseases combined. Although control measures have caused remarkable drops in typhoid fever, in diphtheria, and in smallpox, the downward trend in pneumonia has been very slight. Records show that of every 10 untreated pneumonia patients, 3 will die. When proper specific treatment is given, at least 2 of these 3 deaths can be avoided. But only when the public will recognize the seriousness of the disease and that early proper treatment is of vital importance.
Although that informational video was produced in the 1940s, it is still very much the same. Pneumonia is a very serious and deadly disease. Pneumonia affects approximately 450 million people globally, 7% of the population, and it results in about 4 million deaths per year. The pneumonia mortality rate is much higher for those aged 65 years and older compared to those younger age groups. About 85% of all pneumonia and influenza deaths occur in this age group, and it represents the 7th leading cause of death in this age group. Only about 3% of pneumonia and influenza deaths occurred in those under age 45. Many victims of pneumonia will undergo the unhealthy state until it goes through its course. Many people with pneumonia have to try and get rest while going through the symptoms. With antibiotics, the symptoms should generally lessen in a week. Caretakers may be necessary to assist with some basic functions and ensure recovery. When examining a suspected patient or following the progress of a diagnosed patient, typical methods may include a physical examination by use of a stethoscope or a chest X-ray. Other testing methods include pulse oximetry, sputum analysis, and bronchoscopy. Pulse oximetry is a good way of measuring the amount of oxygen that's in your bloodstream, since pneumonia can limit that. Sputum analysis helps determine the organism that's causing pneumonia. And the bronchoscopy, although it's more invasive, is a more direct means of visualizing the damage. Working in healthcare, we have seen many patients with forms of pneumonia and will continue to treat many more patients for in the future. In radiology, we do more chest exams than any other exam, and most times it is for the purpose to check for this pathology. It is a very serious disease that has taken many lives. Today, it is the final blow to many struggling elderly patients.
I can't understand why anyone wouldn't have a vaccination against pneumonia. We have lost several elderly family members, which was dreadful and terrible to watch and preventable. I contracted bacterial pneumonia in June 2009 and contracted viral pneumonia in October 2015. Bacterial pneumonia is definitely the worst one to get. It is just dreadful.
People in their mid-60s at the moment feel very healthy, and they think that they will not go down with the disease of pneumonia. But as your body ages, you get to be more prone to any of these diseases. I was very shocked to be told I had pneumonia. My breathing was very shallow, I was very weak, unable to do a lot of things that I could do normally. The disease is something that I would never wish upon another person, friend or foe. When you're confined to bed with your lungs filled with fluid, and the physiotherapist coming every day to give you the physiotherapy to break up that fluid. The emotions you go through at the time, you feel as if you can't go on. A physiotherapist visited the house on a daily basis, giving me a thumping on my back to break up the congestion in my lungs. You cannot get your breath, which gives you a hell of a fright. Not being able to get that breath, not having the energy, that you feel as if you want to just give up, and you can't, because life is too important, family is too important.
Can you imagine slowly drowning on your own fluids? Many patients have to stay in the hospital for weeks until that final x-ray clears them for return to their families at home. Treatments can be difficult when other diseases are present and antibiotics are contradicted by other effects and medications. We have all seen these sick patients and can relate to their disadvantaged state that they have become. Times like these, patients are reduced to mere fractions of who they truly are. Family spend long nights caring and worrying for their ill family member. To see someone labored from getting out of bed to do the simplest of basic functions is hard to experience. Pneumonia can have a long-term consequence that can affect their ability to care for themselves, and oftentimes can lead to a downward spiral of depression. Pneumonia is a costly illness, not only for your health, but can cost you a lot for medical bills. Pneumonia accounts for roughly 390,000 hospitalizations among older adults a year, costing Medicare more than $7.3 billion, and hospitalizations for the condition are expected to double by 2040. Nearly half of pneumonia survivors die within a year. So, time for our key question. What is the most common hospital-acquired infection? If you guessed pneumonia, you're right. It is the most common hospital-acquired infection. And last, here's a good shout out to all my sources. If you want to learn more, these are a great place to start. Thank you for watching.